Hello, my name is Amy McInerney and I'm a PhD student at the University College Dublin School of Psychology. I'm going to share a bit with you today on our work in progress project on behalf of myself and my co-authors listed here. Our smartphones collect data indicative of our behaviour and daily lived experience that would be difficult to access reliably in most traditional clinical and research settings. Harnessing this data could provide us with a broader understanding of the relationship between daily behaviours and mental health comorbidities in people with diabetes. Features derived from a smartphone's GPS sensor, such as those listed here, can paint a picture of an individual's patterns of daily physical movement, such as how much they move, when they move, and the number and frequency of places visited. There is emerging research associating some smartphone-derived GPS features with depression and subjective well-being. Our aim here was to examine the prospective association between smartphone-derived GPS features and depression, anxiety, and diabetes distress in people with diabetes and compare it to controls. The Smartphone Behaviour and Mood Study ran this year between February and August, and we had 84 participants take part, 40 of whom were people with diabetes. Participants downloaded the BWI app to their phones for 2 months, and there were 3 levels to our data collection. Starting with validated psychological questionnaires at baseline, 1 month and 2 months follow-up. At the daily level, we had twice daily self-report behaviour and mood. And at the micro level, we had passive continuous GPS. We plan to use multi-level modelling and look at associations between the continuous GPS features and changes in depression, anxiety and diabetes distress. Our next step is data processing, which should be completed in the coming weeks. So I hope this quick summary has been sufficient to give an idea of the project, and I'm hoping we can discuss some of the following questions and issues. To start, I'd be very interested to hear people's opinions on the potential implications of using smartphone-derived data to study mental health in people with diabetes. Are there advantages or disadvantages to using this collection technique that might be specific to people with diabetes? I'm also interested in potential confounders, COVID-19 restrictions, the weather, and how we can take account of these. And are there other external variables that it might be meaningful to include? And I'd really love to hear from anyone who has experience working with continuous data or EMA data on how we can best handle data missingness. And we have 3 levels of data collection, with data missing at each level and missing differentially across participants. So thank you for listening. I'll be happy to answer any questions, and I look very much forward to discussing with you all in real time in a moment.